Hello, everyone, and welcome to the Ramalinga Center's colloquium series on equity and social determinants of health. We are thrilled today to have Dr. Swati Santosh Rane, who has been a big name in these spaces. We've never had a talk about nursing in the 2.5 years that we've done this colloquium series, so we're excited to have somebody represent this very important health cadre here. Dr. Swati is an experienced healthcare specialist with over 25 years of experience in the field. She has a PhD from the Tata Institute of Social Sciences and a master's in hospital administration from the same institution. She's the founder and chief executive officer of the Sevashakti Healthcare Consultancy and is the founder vice president of the Clinical Nursing Research Society. She has over the years been instrumental in pushing nurses to stand for professional rights, demanding their presence in national task forces, and so on. And during the pandemic, she was involved in many advocacy activities that included helping student nurses and frontline nurses at their jobs. She has worked in the private, nonprofit, and public healthcare sectors, from chain hospitals like Apollo and Wockhardt to community hospitals such as the Bombay Municipal Corporation hospitals. And she's done a lot of stress management training courses for the nurses of the state of Maharashtra. As a healthcare specialist in projects and capacity development, she has consulted with hospitals and healthcare facilities at all levels, doing designing and planning, auditing, developing and improving and streamlining operating procedures, and so on. She is a visiting faculty member at the Tata Institute and at the Narsi Monji Institute of Management Studies. She is known for her advocacy work for nurses' rights. For this colloquium, since she's worked so extensively as in the nursing space as an advocate and with the focus on their practice work environments, training and development, and the creation of conditions that can contribute to the provision of safe and quality nursing care, there's no one better to speak on this topic than Dr. Swati. Given her wide-ranging experience in a variety of settings as well, she is well positioned to speak on today's topic, and we welcome her to discuss the challenges and opportunities facing nurses and the nursing profession in India today. Dr. Swati, welcome to our colloquium series.
Hello.
Hello, yes.
Okay. Can you all see me?
Yes, we can. Okay. Just a quick note to our attendees if you have any questions, please put them down in the Q&A box at the bottom of the screen, and we will pick them up for a moderated discussion at the end of Dr. Swati's talk. Thank you so much, Dr. Swati. All yours now.
Thank you. So let me first thank Ramalinga Center on Equity and Social Determinants of Health for giving me this opportunity to talk about nursing profession and the challenges that they face. And I thank the organizing team of the institution. I thank Dr. Abha for reaching me out for such a beautiful topic to be discussed on this platform, where we have many of public health people, and it is a very nice way to discuss this issue, which I think, as I always say, nursing is not only a clinical profession, it is more of a societal profession or a social profession. So I thank you all. So should we start, Abha? Yes. Okay. So before I start, I would be very happy if we would be doing a two-way interactions instead of me just presenting. I would be happy if we could have an interactive session just 2 to 3 minutes before I start, so that from there I can pick up. Is that okay, Abha?
I don't know if I'll have to ask Radhika here. I don't know if we've set up our Zoom seminar in such a way that I mean, people can write questions and we can pick them up, but it's okay. Hard to have an open interaction.
Okay, fine. So let's do that. You can put it down in the chat box, whatever I ask, and then we can have that way the interaction, because it will be very nice for me also to learn from you guys what you all think about nursing profession is. Okay, so just before starting, what do you think about nursing or the nursing profession in just one liner? You can put it in the chat box. Till the time I'll start sharing my PPT. Can you all see it?
Yes, we can.
Yeah, great. I'm getting my first noble profession, but underutilized. Okay, wow. Thanks. Anybody else? It would be very nice if we have an interactive session. A very noble profession that plays a vital part in delivering a very important service. Thank you, Neeraj Acharya and Gayatri Raghuraman, for your thoughts. Okay, great, great. That's a very good start as a noble profession. So, okay, now let me ask this question. Do you think, uh, other than noble profession, something more about nurses' role or nursing profession? Any other thought other than noble profession or angels or something of that sort? Any other words which come to your mind? Overworked. Okay, great. Thank you, Trivikram. Okay. Anybody else? Okay. So I think we will be having more coming in. Can you see the slide? Feminized labor. Lovely. Very good, Gayatri. Thanks for that. You're setting the tone for my presentation. Thank you so much. More crucial unit for delivering access to healthcare. Great. Yashashvi, thank you. Expressing compassion even though overloaded. Okay, fine, great. Thanks, Neeraj. So let's start with the things what I have to present y'all. Okay, there is one more multitasking. Ma'am, frontline workers. Okay. I'll put it in presentation mode. Yes, just give me a minute. Uh, okay, Aruna, thank you. Sherry, thank you. Yes. Radik, I'll just put it in the presentation mode. Yeah. Great. Can you all see it now in a better? Yeah. So, yes. Uh, so when we think about nursing, I always thought first, when I joined nursing, way back in 1994. And till that time, I didn't know it was a noble profession. For me, it was a profession. Yeah, a profession which was a sure shot where I would get a job and a sure shot profession which will give me a good degree, which is internationally recognized, and a profession which is required in every nook and corner of the world. So that was the reason I joined nursing. As I will be giving you my narrative also as a nurse and a nursing advocate. I don't call myself as a leader, but I call myself as a nursing advocate and a nurse. So, while doing nursing, I came to know a lot of things. That nursing was not something which was a profession before. In the ancient times, nursing was more of a care part, which usually a women did because women are, you know, women have an image of compassion, but I think even men are compassionate because I have a very compassionate father and a husband. So I think we all think the same, or we are on the same path that even males are compassionate. Uh, in the in the ancient India, we also saw that there were dais who were trained birth attendants, who were there everywhere in India, and they were the ones who were called for deliveries. And in the medical text, it has been very well mentioned in Charka Samhita that the nurse should be very knowledgeable about the medication preparation and care part, and also she should be managing her hygiene very well. This is something I'm taking you back to history because I want to set the tone from where we were and where we are today. There was definitely the influence of Britishers due to the World War, and also because they wanted to give their people who were in India uh, to get good care. So there is definitely influence of Florence Nightingale in the Indian nursing. So during the colonial period, uh, the nursing which was not so much formal, or it was more of a vocation. I still remember when I was doing nursing, when I used to tell it is a I'm in this profession, many of my teachers used to correct me. No, no, we are not a profession, we are still a vocation. And I used to get very angry. I said, what type of this? I'm coming here for a BSc degree and they're telling me it is a vocation. Because for me, vocation was some 3-month, 4-month course, okay? And then as we ventured more into larger roles, now it has been given a title of profession. Okay, so let's understand how this profession developed. Yes, I'm getting something. Is there any recording available after the session? I don't know. Okay, not gain in service education. Okay, it's 1 minute, huh? So, yes. So it's the formalization of this whole thing began in 1871, where the first nursing school for midwife was established in Madras. And then it went on in 1990, the Bombay Presidency Nursing Association was established. Then in 1907 to 1910, the United Board of Examiners of Mission was established. 1916, the Trained Nursing Association was there for promoting nursing profession and also to educate the rights of nurses. Post-independence, we can see that Indian Nursing Council was established. I think many councils were established at that time. So even nursing was given that due respect. And in 1946, the first 4-year basic BSc program was started in RAK. So this is how the professional development of this whole profession was started. Okay. Then comes is some facts about the nursing education. So I just want to know that, do you all know how much hours nurses spend in their nursing college? Before seeing the slide, I would like to know if you all knew, yes or no. Just give me yes or no. Yes, I want to know this very much from the audience. Did you all know that nurses spend around 3,000 to 4,000 hours in the whole professional development? No, very good. Thank you so much. Ozukum, thank you so much, Gayatri. Thank you so much, Srilata Rao. Thank you so much. Yes, Miss Tino, thank you so much. Yes, and I was also surprised. 4 years is what was known, but the number of hours are yes, yes, yes. Neeraj, I completely agree with you. It was astounding because I was thinking as a nurse, as a nursing student, I was working in critical care unit of a very big hospital in Mumbai. And my colleagues were doctors and technicians and administrators. And I used to think, like, I'm in par with them. Everybody knows like what is a nurse and how much knowledge we have and how many hours we spend in understanding the theory, doing the practice, because we practice not only nursing as in care part, but we also do a lot of medical clinical part also. So I thought, and we were trained like that. We were empowered from the school or from the nursing college, you can say. And I'm very proud to say that I'm from LT College of Nursing, Mumbai, SNDT, and it is a women's university. So you understand how much empowered we were. So when I started getting into this nursing profession as a professional graduate nurse or registered nurse, I started thinking that these people really, I started having doubts because they used to talk to us as if, we were some dumps. This was the word which I used to think when I used to interact with the doctors. And then when we started talking to them, they would say that, how do you know so much? Because this is the first year of yours. And how do you know so much? And I used to think, like, why would I not know so much? Because I've studied so much. Okay. And this is what the image is of nurses in India, that that our own colleagues, our own doctor friends don't know about nursing education. or the knowledge what the nurses have today. Okay. And that was very demeaning for me as a nurse. And slowly, I started also seeing the challenges of the profession, and I was not happy about it. So I thought, in this presentation, it is very important for me to create a advocacy and agency for nurses by showing what nurses do in those 4 years. Where do they spend these 4,000 to 5,000 hours? Okay, so let's see. So the whole course is spread for around 4,000 to 5,000 total hours, okay, of where theory and practice is there both. And it is very well structured course. It is, I would say it is a very integrated course, you can say, because we learn lots. So there are 4 years, 8 semesters, 40 hours every week a nurse spends, okay? And here I want to talk about the cost, because when I did nursing was not so costly, okay? It was very much easy to become a nurse. But today, the situation because of privatization has changed. The cost of BSc nursing course in private college can range from 50,000 to 3 lakh per year. Okay. It is not only about the fees, but about all the accommodation, their stay, and their other activities. The cost of BSc nursing in public, I'm sorry, I have not put that public thing. So in public hospitals, it may range from 7,000 to a lakh. Okay, so that is the great difference in the education of a nurse in public sector and private sector. And we will see how it has become a pain point for the nursing profession. Okay, so let me tell you, what do the nurses study? Yeah, so the subjects what we do study are the theory and practice. In the basic sciences, we study anatomy, physiology, biochemistry, biophysics, microbiology, pathology, psychology. That is the basic sciences which we study. Then we study in the nursing fundamentals, introduction to nursing, first aid, nursing ethics and professionalism, health assessment, communication skills. In the clinical specialities, medical surgical nursing, where all your systems are covered. That is your cardiology, neurology, your renal, everything is covered, both surgical and non-surgical, I mean medical both. Pediatric nursing, community health nursing, mental health nursing, in which we cover psychiatry, maternity nursing, where we cover gynecology and obstetrics, operating room nursing. Here we cover all the procedures and instruments learning, the OR techniques, everything is covered here. And in the allied subjects, we study pharmacology, we study nutrition and dietetics, applied nutrition, health education, and research and methodology. With that, this is the theory part. With that, we also do our clinical practice in each specialized area. Okay, so you will find us working in ORs, in intensive care units, in medical surgical wards, in specialized wards like cardiology or cardiothoracic units, renal units, dialysis units. So this is the way we are trained. This I'm talking about the general nursing and BSc nursing. Okay. So there is a course called as ANM, Auxiliary Nurse Midwife, to start with, which is not a nursing course, but they help in midwives, or they conduct deliveries and they take care of the baby and the mother. That is, which I have not put here. But later on, there is also a general nursing, a diploma course, which is still running, which was planned to be phased out, but it is still there. Then the degree in nursing starts with Bachelor's of Nursing, which is a 4-year degree course with 1 year of training or internship. Then we have Masters of Science in Nursing. So this is again a specialized area where they do masters in nursing specialized area. It can be pediatric, it can be med surg, it can be community. Okay, there are many specializations it can be mental health. So many specializations have come up now. There is a new program which was launched recently, that is Doctors of Nursing Practice, that is DNP. So Doctor of Nursing Practice degree in India was launched by Indian Nursing Council as a pilot program, a higher level of clinical expertise and leadership through advanced nursing practice education, where they are trained to take care of the intensive care patients, where they can even intubate the patients. They can do a lot of procedures, which the doctors usually do, or the technicians do. And these are there at two places in India, that is Mahatma Gandhi Mission Institute of Health Sciences and Krishna Institute of Medical Sciences. And it is launched in collaboration with University of Houston. So which are the top nursing colleges in India? AIMS Delhi, PGIMR, CMC Vellore, and NIMHANS. Okay. So before we go to the shortage or the key challenges of nurses, I would want to know from the audience, how do you feel after hearing about the nursing education, what they have? In the chat box, please. Has something changed about thinking about a nurse among you? In the chat box, please. After seeing this, how much they know and what they do, what is your thought on this? 4 or 5 slides, what I have presented. Gayatri says, definitely when I used to practice, did not know their potential. Should be more given more responsibilities. Yes, Abba, absolutely they should be given more responsibilities, because they are just told to do tasks, medicine, injection, vitals, temperature, BP, follow doctor's instructions. That's it. And where do you use this knowledge if your scope is so limited? Yeah. So very happy to know about doctor course. Yes, that is much needed. And yes, absolutely. Because of the shortage of doctors and the shortage of nurses, especially the skilled nurses, and looking at the intensive care units requiring more specialized skilled nurses with knowledge and practice, this program was launched so that, you know, the nurses' scope is increased, and many of the nurses who are going abroad, they may see that there is a scope and they may do these things and they would be more satisfied staying back in India. Yeah. Yes. Ozukum, yes, nursing has evolved. Yes, very much. And they are good researchers also. Many of our nurses like me have done hospital administration course or masters in public health, and they are doing fabulous in public health and in hospital administration also. Scope must depend on ratio of staff. Yeah, we'll be coming to that. Their skills and education is, of course, it is not utilized, because you're going to tell me the reasons why it is not utilized. Yes, Linto says the current scope of practice is not as per the educational. Yes, I completely agree to you, Linto, and we have to work hard on that. By doing a lot of advocacy work. Yes, scope must depend on the, yeah, this is done. Great, thank you so much for that. So I think I've set the tone right. Okay, and we go back here. Fine. Okay, what am I missing here? Okay, just a moment. Yeah. So the key challenges, I think we all agree what are the key challenges in India, which the nurses face. One is shortage of staff. To be very frank, when I started doing research and started speaking to the administrators and the nursing uh, educationists and the nursing practitioners, what I came to know that there is no shortage of nurses, because we see there is high number of nurses passing out, okay, from the nursing colleges, and we are actually exporting nurses. So where is the reason why there should be a shortage of nurse? Okay, so the staff shortage is there because of many other reasons. Okay, we are producing good amount of nurses. Okay, so we have to understand that reason why the shortage is there. Okay, and this shortage is actually creating a lot of problem on ground, leading to heavy workloads and pressure and burnout and stress on nurses, which is directly impacting the patient care, the quality of patient care. And there are so many errors which are happening, and it is very bad and sad to see that, there is no reason for a patient to get such quality of care when they are paying through their nose, in private healthcare, but they're not getting that type of good nursing care because the staff shortage is there. Okay, the similar thing we are seeing also in the public healthcare. Now let's understand the violence and the harassment. During COVID, we have seen, and I have done a lot of advocacy work for the nurses, because they were harassed not only at the front line, but by the management, by the patient, by the relatives, by their own nursing people. Okay. And lot of nurses now complain that there is lot of verbal and physical abuse, okay, from the patients and their families, okay, which is creating a lot of toxic environment. Then low pay and poor working conditions. We all know that the nurses are underpaid. Even after the state of Kerala stating that they should be paid minimum 20,000. This I'm talking about some 7-10 years back, this thing had come. Still, you can find nurses working for 10,000, 12,000, okay, in some areas. So that is again creating a lot of exploitation. Gender disparity, yes, healthcare system in India often perpetuates gender bias, creating difficulties for male nurses, not only female nurses, but also for male nurses. Unfortunately, in nursing, we are seeing gender bias both ways, female and male, both. And now it is the third gender is also seeing that, because we are now seeing that many third genders are taking up nursing profession, okay, and the tone is not set in the nursing profession for the third gender people, okay, which is very sad. Lack of adequate clinical training. Looking at the way the mushrooming of the uh, private colleges which has come up, the quality of education has become very poor. Most of them, I have heard in colleges, clinical practice they don't get because they are not skilled teachers. Okay, because most of them have very young junior teachers who themselves have not worked in the hospitals. Okay, so that is one problem here. And few colleges I have heard that they teach them on YouTube videos, and that is very sad. Okay, so this is the level of education, what is happening in the education field. Rural healthcare gap, again, the rural healthcare is having its own challenges, because many nurses are not interested to go in the rural areas, okay, because rural areas have lack of infrastructure for them, okay. Migration overseas. So due to better pay and working condition, many Indian nurses migrate to other countries. But again, after migration, they are facing so much of problem in the countries like Germany, where the language is an issue. They have a lot of issues in Germany again, because many are going through wrong routes or wrong agents. Okay, so that is again a big problem which we are seeing. So nursing is facing a lot of issues. Okay, then lack of recognition and autonomy. As I earlier said, that they are so much well qualified, well educated, well experienced, but they don't get that respect or decision making power in the healthcare system because of the hierarchy, where always the administration thinks that the doctors know better than the nurses, and the nurses are always taken as, a handsmaiden of the doctor. It is still there, and that is unfortunate. Pandemic related stress, yes, the COVID-19 pandemic has further intensified the workload and stress levels in nurses, because nurses are not yet been healed with the trauma what they suffered during pandemic. They are still, many nurses are having mental issues which are not taken care of. Okay. Outdated technologies and infrastructure. Many places you will see that many nurses do very rudimentary work, which because the new technology or equipment has not come in, and because of that, lot of them face a lot of problems related to their health. So these are the challenges which many nurses are suffering. Okay. And I would suggest here, before I take up the next slide, how many of you all prioritize? Can you just write in the chat box some 3 challenges which you think that these are the challenges which we should take care of for the nurses? I have listed many, but according to you, what are the priorities which you feel that, which should be taken care of very soon, so that the nurses, yes, workplace violence, very important, because if she is not herself safe, how can she make the patients safe? So that is a very much important thing. Yes, thank you, Suresh. Gayatri, better pay and recognition. Yes. Yeah, without pay, who is going to stay back, right? When you give peanuts, you get only monkeys. Yeah. Great. Duty hours. Yeah. They are given 12 hours, but they work more than 12 hours. And humanly, it is not good. Communication skills, yes. Very much important to train them on the communication skills. Thank you. Thank you so much. Standardized curriculum. It is standardized. The curriculum is standardized. Yes, leadership is required. Not followed. Yes. Yes, I agree. That's what I said. Many of the colleges use YouTube for teaching. Okay. So yes, this is something which we have to take care of. Yeah. And why do you think it is so important to work on these challenges? How is it going to help? How is it going to help the nurses? Who is going to get benefited? Okay. So now let's come to our male nurses. So as I told you earlier also that nursing has gender bias both ways. Okay. Even our male nurses are facing issues. Okay. And that is one big problem which we are facing, because many men are interested to become nurse, but many men are suffering in a female dominated profession. Okay. And there are many reasons to it. Let's understand what are those reasons. Yeah. So gender stereotype and social stigma, because when you say a nurse, only a female figure comes in front of you. And whenever our men or boys go for nursing, they are belittled by their friends, families, okay? Because still people think that a nurse should be a woman. Okay, Aruna is saying what? When discuss equity in healthcare, there is urgent need to discuss fairness, agency, power. Yes, Aruna, I completely agree with you. Okay, so this is one thing which is happening in that is the reason many men are not joining nursing. If you see in US, the ratio is equal, the boys to girls ratio who are joining nursing. Limited career growth and opportunities, because again, there is a barrier to the leadership roles and career development, again, due to gender bias. Few mentorships opportunities are there. Limited option for specializations due to gender dominance definitely is there. Workplace discrimination and harassment, gender bias from female colleagues and patients. Many a time, male nurses are not allowed to work in female wards. Okay. Male nurses may experience harassment and inappropriate comments also, which can create low self-esteem for them. Lack of supportive policies are there. Limited family, because see again, when a male comes, he's a primary bread earner of the family. So he needs to be taken care of much more because he, till now, at least we see that, males are being responsible to take care of the families. So if that male is not being taken care of financially, okay, then it becomes a big problem for them. So limited family leave benefits or support for nurses, absence of gender sensitive policies in healthcare institutions are there. Emotional and physical labor expectation is high, okay, because of the caregiving role and the stereotypes. So that is again, many male nurses are treated very badly. Many of times they get physical attacks also. Okay. Underrepresentation, very small percentage we have. Okay. So they feel isolated. Very few male role models are there in the leadership and in policy making. And it is also seen that males usually, because they are working in female dominated profession, they don't want to be around females. So they just, try to be pally with the doctors or the technicians or the ward boys, and you will find them in a different group. And most of them feel very isolated and in the female group. And I don't know what is the reason of isolation. They should not feel, because it is a professional conduct which they have to manage. And fewer times, many nursing leaderships have complained that male nurses don't want to do frontline jobs. They just want to do jobs which are non-care oriented. Okay, that is also one big problem with the male nurses. And that is one of the reason many male nurses are not been accepted by many organizations, because a lot of issues happen with the male nurses about their behavior, about their conduct, which many organizations feel that, females are better than male nurses, which they have to work on. Negative public perception and stereotype in the media. Okay, that is interpretation in the media is there about the male nurses. Uh, Public awareness is not there about their contribution. They are doing a lot of work, okay, but it is not known. Inadequate legal protection and care support is there. Family and societal expectations, okay, pressure to pursue more masculine career, okay. So again, they have to fight a battle on many sides, on the personal side, on the professional side, and also individual, as an individual, they have to go through lots, I think, and we have to empathize with them. Lack of training and development is seen among them related to the gender sensitivity. Gender specific training gaps, limited access to gender sensitive training. Male nurses may receive less training in emotional care and patient empathy. Uh, that is one thing which we have to be alert of. Uh, the conclusion, what I feel is that, male nurses face significant challenges related to gender bias, limited career opportunities, high expectations are there. So to address these issues, we have to create a lot of awareness. We have to create a lot of advocacy work for them, and we have to overcome this stigma by, empathizing with the male nurses. And the similar thing, I'm talking about the third gender also. Uh, we have to prepare our organizations, our mindsets to accept the third gender. Okay. Yes. Before we go to the Nursing Midwife Act, um, any thoughts on what we just spoke about, the male issues, male nursing issues? I could see many male nurses here. Mm. Yes, hypocrisy modem to be explored by nursing leaders, designated nurses who are in position. Yes. Okay. Fine. Okay. So we thought that, you know, at least I thought that the new Nursing Act will be more empowering act, and it would be, uh, it was after a long time that we were working on the act, and we thought that there will be many consultations at the national level, state level, and many of us could give our thoughts on. I just want to stop this for 2 minutes before I start. Uh, so when the nursing midwife bill was put on the website, okay, it was so poor management was there from the government, because we didn't even know that the bill was put on the website. Somebody got a SMS from the government, SMS on WhatsApp. Okay. So WhatsApp message that there is a bill there, and within a few days you have to reply to the bill. Okay. And it was such a shock to all of us, because many of them didn't know. There are more than 25 to 30 lakh nurses. Can you believe, to reach them in few days and do advocacy work? There was no consultation at all at the state levels. They had made on their own uh, a, of a committee, okay, and that committee also first had few private and public nurses, and later on we came to know that later on the private nurses were not asked any information or any work on it. There were only 1 or 2 or 3 members or 4 members who were working on that bill. Can you believe 30 lakh nurses representation was done by 3 or 4 people without consultation, and they are just put on the website that whatever your thoughts are there, you want to talk about the bill, you put it. Okay. And we did a lot of advocacy work for that, and we wrote to government what changes we wanted, and we thought that after the government gets all the information, they will call us for the meetings or for consultation, but there was nothing done. Even the committee which was formed before, where there were private nurses. Why I'm talking about private nurses? Because healthcare is 80% private. So if 80% representation is not there, what is the bill going to help, and who the bill is going to help? And as we see the bill, you will see what the flaws are, because the proper representation of the people were not there from the private sector. Any thoughts anybody has on this way of, because it was not only nursing act or the nursing bill, even the other bills were made by the government in the same fashion. Okay. So many of them who are from other what do you say, streams like pharmacology or social work or public health, I think we face the same problem, even the medicine. So this was one big issue which I personally didn't like, and we had to work a lot on this. And after working also, there was nothing being taken. I mean, there was no system which we could, talk to the government about it. And now again, we will have to work on it, because the bill is not having anything related to the scope or practice of nursing. Okay. And they are saying that they will be talking about it, but I don't know when. Okay. So coming back to it. Okay. So, yes. So the gaps in the National Nursing and Midwives Act. The first gap, before even starting to go, nursing and midwife are two different things. Midwife is obs and gynac, okay? And nursing is nursing care to the patient. So a pregnant woman is not a patient. So there should have been actually two bills, National Nursing Act and National Midwife Act. And again, as the other countries have, they have two courses. One is a nursing course and one is a midwifery course. Because a midwife cannot be taken into the hospital to work in any other specialization than obs and gynec. She cannot work in ICU. She cannot work in medical surgical ward. And in the same manner, it will be very difficult for a nurse if she's not having a proper training on conducting deliveries. She cannot be put in the delivery ward. Okay, so this was the main gap which we all wanted, that there should be two bills, but unfortunately they have compressed everything in one bill. Okay, so now let's see what are the gaps. Lack of autonomy. Nursing councils often function under medical and bureaucratic control, limiting independent decision making. Till now, Maharashtra Nursing Council was under the doctors or the administration. Recently, again, they have won the battle, and again, we are having a nurse as a medical council head. Weak representation. Nurses and midwives have very little to say on the regulatory decision, because again, nursing course does not train them on the advocacy or the policy or a regulatory making or a policy making syllabus. Is in the syllabus, it is not there, this part. Unclear scope of practice. In this act, no clear role definition of advanced practice nurses is there, leading to conflicts with the other healthcare professionals. Poor education regulation. Outdated curriculum is there. As I said, 5,000 hours they are spending, okay, but still we are not getting good quality products. Inconsistent accreditation is there. Lack of enforcement of quality standards. Many nursing colleges are just one box. Recently in Madhya Pradesh, there were many nursing colleges which were closed because literally there were no teachers. There was one or two rooms as nursing colleges. So there is a lot of corruption going on in this. Workforce exploitation. No legal backing for safe nurse-patient ratios, fair wages, or protection for violence is there. Limited financial support. So these things are not at all covered in that bill. Okay. Nursing councils lack funding for research, audit, and professional development. Hospital-centric approach. Minimal recognition for the community health nursing midwifery-led care product models is there. Restricted advocacy. Private sector nurses face barriers in union. So unions are not allowed in private sector, and the bill doesn't talk about unionizing and collective bargaining or negotiations. And that is a very sad thing. Okay, because where will the private nurses go without unions? In public hospitals, we have unions. Private health sector, they are not allowing unions. And that is the major regulatory and governance flaw. Weak continuing education. No mandatory continuing professional development program is there. Okay. Or periodic relicensing is there. The nurse who has done her GNM or BSc way back 30 years, okay, hardly she takes any CNM programs. And that also, they are of very, CNEs are of a very poor quality. Okay. And there are no exams for relicensing. So we don't know how much she's really aware of what she's practicing. Okay. Minimal research and policy integration. Nurses are excluded completely from health policy formation and evidence-based decision making. So what can we do? Grant autonomy to the nursing regulatory bodies. Male nurse, okay, this I'm talking about the male nurses issues, okay. So male nurses must be more on the front line to uplift the nursing leadership. Define, expand nursing roles in primary and specialist care. Strengthen education, workforce, conditions, and advocacy efforts. Yes. Coming back to the nursing bill. Okay. So here, why did it happen? Okay. What are the reasons of this weak nursing midwifery act? Okay. So lack of strong nursing representation. Minimal involvement was there in drafting the policies of the midwives and the nurses. Okay. As I said, there was one committee which was formed, and these, I don't know, 4 ladies or men, whoever were there, they really didn't do their jobs well. I'm sorry to say that. Decision-making power is dominated by bureaucrats and non-nursing professionals, which we can see in the bill. Okay. Hardly we can see any nursing related empowerment related things are there in that bill. No effective consultation with nursing organizations and stakeholders, which I said. Weak governance and regulatory framework. No clear guidelines for licensing, education and practice standards. Inefficient state and national nursing councils with limited enforcement power. Lack of mechanism to monitor compliance with nursing regulations. Complete exclusion of private nursing, okay, was there. 70 to 80% of nurses work in private sector but have no voice in policy making. The bill does not address wages, working conditions, and rights of private sector nurses. Lack of recognition and support for private hospitals, nursing workforce. Poor workforce planning and career progression. No structured career pathway is there, leading to stagnation, absence of clear promotion mechanisms or cadre structure. We don't have that. No proper recruitment policies, leading to shortage and overwork. Weak legal protection for nurses. No strong legal framework to protect nurses from workplace violence or harassment. Lack of policies ensuring safe working conditions and fair wages. No protection against unfair dismissals or exploitative contracts. Many nurses don't even sign contracts before joining. They are not even aware of it, unfortunately. Inadequate recognitions of advanced nursing roles. The bill does not support nurse practitioners, midwife-led care, and community health nurses. No legal backing for nurses to practice independently. There is a lot of resistance from the medical authorities against expanding the scope of practice of nursing. Oppositions from the medical and bureaucratic authorities. Doctors see nurse practitioners as a threat to their authority. Bureaucratic dominance limit nurses' autonomy and decision-making power. The medical fraternity's lobbying is quite stronger and influencing policies outcomes against nurses. Weak lobbying by the nursing organizations. Nursing organizations are completely fragmented, underfunded, and they lack unity. Unlike medical association, nursing groups struggle to push for legislative changes. No strong advocacy for nursing rights and policy improvement. Nurses are not taught about advocacy, unfortunately, and unionization is treated as bad. I don't know why unionization is treated as a bad way of conduct. Unionizing is considered that it is not good. Nurses should not unionize. I know. I really don't understand how unionization is bad. Okay. Financial constraints and poor resource allocation. Low government investment in nursing education, workforce development and training. They have recently said that there will be some more 100 colleges. I don't know from where they are going to get teachers for these 100 colleges which are going to come. Nurse faces low wages, excessive workloads, and lack benefits. Poor planning and budget allocation for nursing infrastructure and welfare. There is no budget allocation in any nursing, in any municipal corporation or in government for nurses or nursing welfare. Okay. Outdated nursing education system, no modernization of nursing education system to meet global standards, lack of integration of technology, research, and evidence-based practices, poor collaboration between education institutes and healthcare facilities. What do we do then? The National Nursing Midwife Act needs an urgent reform, ensure nursing representation and policy making, strengthen governance, legal protection, and workforce planning. There is no ratios being defined in this act, okay? No nursing ratios are defined in the act. Expand scope of nursing practice with legal backing, improve working conditions, financial investment, and nursing education. Without these reforms, the act will remain ineffective in addressing critical issues affecting the nursing and the midwives in India. Okay, before I go to the next, I would like to stop here and take up questions if you have any.
I was just going to say, Swati, that actually it's almost 5 o'clock, which is usually around the time that we wind up the talk.
Yeah. That's the reason I stopped.
Okay. Attendees, please put your questions in the Q&A box. I think Dr. Swati looks eager to have a discussion with some of you about some of the topics that have been raised. This was Very helpful. Can I just get started though with the conversation while
Yeah,
people
please.
have a moment to type up their notes? No,
Yes.
this was extremely helpful. You know, I was just realizing that I mean, obviously there is yeah, obviously there's a lot of discussion around you know, doctors and doctors working conditions and those kinds of things. And I think in more recent years there's also been a lot of discussion around asha workers or anganwadi workers and their working conditions. There is, but that middle cadre which actually does a lot of the clinical work, as you pointed out, we don't actually know a lot around them, right? We don't hear from them so much, we don't do a lot of research around them and so on. So this was very helpful, I think, to get a sense of what it is in that middle cadre. A couple of very basic questions, actually. As you pointed out, the act, which has the potential, I think, if it was written well, to protect the nursing profession in India, is written extremely poorly. And as you mentioned, just some 3-4 people have been involved in writing it. So who has been involved in writing it? It's not clear to me. We know who has not been involved in writing it, but who was involved in
So
writing it?
these are few nurses which they had identified from private and public institutions. A few are retired ones also who were there. But yeah, and there is a committee which you can see. There are names there. I don't remember many of them now. But these are the nurses from public sector, retired nurses. But they have really not done good job of presenting the nursing issues, unfortunately.
Yes, that seems to be the case. Is there, I mean, one of the things that struck me is how public sector nurses are actually very, in a way, separated from their peers in the private sector. They're separated from the medical profession as a large, you know, the doctors and all that. How it feels like fostering some conversations between, you know, public sector nurses who only make up 20%, as you said, of the nursing sector, uh, to have these conversations with, you know, private sector nurses who are not allowed to unionize. I mean, I feel like everyone stands to benefit from it. How do you, as an activist, you know, you play many roles, I think, with respect to the nursing profession, but how do you generate these kinds of conversations to get, you know, to get a better relationship with other cadres, to have a voice in this? It just seems like nurses are lacking a voice overall in anything to do with their profession. How do you create that space for them?
See, to be very frank, if you see, nurses are fragmented, not because they want to be fragmented, because the position where they are there, that is very much fragmented. Because if you see in public health sector, the healthcare facilities are divided. Okay. So you will see that there is a railway hospital. So the union of railway hospital will be there. Central government hospitals, that is a separate hospital. ESI hospitals, that is a separate hospitals, though they are public healthcare hospitals. Then municipal corporation hospitals, they are separate hospitals. Okay, so there are many mission related hospitals which are state funded or maybe funded by the government. They are separate. So that is one reason you can find so many fragmentation among the nurses itself. Okay, among them also there are again different unions. Okay, so they are divided among the unions. Okay, so that is one part in that small 20% space of public healthcare hospitals. Private healthcare hospitals, no way. If you are going to join a union, you will be out. So it is in their contract itself that unsaid or unwritten thing that, you know, you cannot join any unions.
So they can't even have these conversations safely without
No,
risking their
where?
jobs.
How? And that is the reason you can see so many nurses are going abroad.
We have a couple of questions coming in right now. So
Yes.
Sanjana asks, actually she has two questions. First,
Yeah.
she thanks you for the presentation.
Yeah.
She says that the act does not specify the scope of practice for nursing. So
Yeah.
she's asked, what document do nursing professionals currently refer to for the scope of practice? Is there any kind of official documentation?
Unfortunately, that's why we were struggling and advocating that there should be scope of nurses, because the previous document which we had, the Indian Nursing Council Act, that also lacked the scope. It was concentrating only on the education part and the accreditation of the education institutions. The scope part was completely missing in the previous act. So we thought that in this act, the scope will be defined. But unfortunately, there is no document. Unfortunately, there in India, there is no document for reference for the scope of nursing practice.
Can you actually, this is a follow-up question that Sanjana herself asked, but how, if you were to contribute to writing this document, how would you phrase it? I mean, since you said there is actually nothing to work with
See, my
even.
first thing, it would be to make a structure, okay, where we call upon right people from the education, from the practice, from the midwifery, and set a proper committee, okay, and do consultations at the state levels first, and then come to the national level. See, because this is not what I want. It is what the profession wants. And the profession has 30 lakh nurses. If there is no voice from them, and where is the private sector, which is there 70 to 80%? You have completely removed private sector from the scope or from the act. You're just concentrating because it is a government policy. You're just concentrating on the government institution. Unfortunately, your government is not giving, it is not a service provider, healthcare service provider. Your government is only 20% service healthcare provider. 80% of the healthcare provision is from the private sector. So where is that majority? That is what I'm asking. So I would suggest that, I would bring in more of the private sector nurse to write the policy document instead of bringing in the public sector nurses who are retired. And I think they really need to upgrade themselves about the problems. And they are not trained, I think, looking at the draft, I feel they need training how to draft a policy and what issues. Because 70 to 80% chunk of the nursing problems, they have not taken into consideration. And that is very sad.
Yeah, these are, as you said, well-documented problems. So the fact that they've
Yes.
been not taken.
Yes, and this is donkey's years, yeah. If you see in 1927, what issues were there, the same issues are there in 2024 also.
100
And I
years
think these
later.
people have seen the whole evolution of nursing. The people who have written the nursing document, the act or the bill, they have seen the whole evolution of the nursing, and still they have not catered to the right people. 70 to 80% of the private care is not being catered to.
Thank you. Gayatri asked, I think, a very interesting question. She says, what are some models, to talk a little bit more about the community health nursing models? What is the role of the community health nurse? And is their training any different? How are they assigned to public?
See, nursing trainings, if you really see, as mentioned in the Bhore committee report also, they had very specifically said that we should be primary healthcare oriented and the nurses should be there in the primary healthcare and they have to be empowered so that the primary healthcare center can be run by the nurses. Okay, because the actual care part is required in the primary healthcare centers. Okay, the treatment part and all these comes in the secondary and tertiary level. So I think that primary healthcare models, we were very well there, looking at the primary healthcare centers, but it didn't evolve. Okay, and many of the rural healthcare centers are run by the doctors. So I don't see any scope for nurses there, other than following the orders of the doctors.
Ideally, it is supposed to be, I mean, they're supposed to have this sort of larger role where within the community, they have some authority and
So now they have
responsibility.
brought in community health nurse post. Okay. So where, these nurses are doing quite a good amount of job. They're doing administrative and clinical and nursing activities. So that trio is helping here. But it is only in the government sector, not in the private sector where I find.
Yes. Suresh has a few questions. He says, I mean, one of the questions he asked, and I think, is how to prevent violence against nursing professions. I think once again, there's been, we've read a little bit about, or there's a little bit of discussion around violence against doctors, but I think nurses, because they're most often face to face with the patients.
It is under the carpet.
So right now they don't deal with it basically.
No, they deal with it, but their complaints are always put under the carpet.
So
Okay.
how, once again, what would be a suggestion?
Training, gender sensitivity training, training about the medical laws, empowering the nurses, creating a environment where the nurses can come out and voice out. Okay, creating very good work friendly policies for the nurses. Okay,
Hmm.
that's the way we go about. Nurses
Okay.
are not trained. See, the nurse, a student nurse, the first year student nurse enters this environment. Okay, she enters the hospital without any guidance on gender sensitivity. That's a very sad thing.
So in a way, you're saying there has to be sensitivity from, I mean, from the nurses themselves to have a little more
Yes, in
training
the
and so on.
curriculum, it should be there.
But how do we handle violence from others, those who patients
See,
or patients?
violence is not only happening to the nurses who are graduate nurses or registered nurses. Violence is happening to the student nurses also
Hmm.
because they are working on the shifts. Okay, so I feel that they have to add this thing in the curriculum in the first year itself.
Hmm.
Gender
So
sensitivity training, it has to be there.
to better prepare them for what they will encounter
Yes,
in the
yes,
hospital, in the clinical
yes,
setting.
yes.
Thank you. Sumran asks how to provide in-service education for nursing officers who want to, perhaps get advanced training or,
I think there are a
during
lot of
service.
trainings which are going on.
Hmm.
Every nursing council has their continuing education programs which are there. Many private nurses hold a lot of programs.
Hmm.
And my organization, Sevashakti Healthcare Consultancy, does lot of leadership programs
Hmm.
for nurses. Now we are going to launch a course which is going to be a 3 months course on on the weekends for the nurses on leadership again. So they can join such courses and upgrade themselves.
Okay. I think I have a question here actually. I think the couple of more comments, which I hope you'll read the chat box and you get a chance, we can send it to you later on. I wanted to talk a little bit more about the issue of contract workers. Increasingly we hear in government hospitals how some of the nurses are contractors and some of them are, employed by the hospitals themselves. And there is often, I mean, you pointed out already how fragmented the nursing profession is, even within an institution.
Yeah,
And we
yeah,
get the sense, in conversations with nurses that there is a lot of not conflict between them necessarily, but some resentment and so on about the fact that, some of them have been working in the same role for 5-10 years and they've still
yeah,
not been promoted to full-time
yeah.
employees. So can you speak a little bit more about this increasing reliance on contract work, even
See,
within the
again, the
public nursing?
whole game is of privatization because so much of unfortunate things are happening because everywhere privatization has been holding things, and government is not ready to fund or increase the GDP in the healthcare sector. So even in government hospitals, the contractual labor is on a high demand. Hardly there are permanent seats available in the government sector. So it is privatization is the reason for it, and government doesn't want to invest. So
Hmm.
I think the advocacy should come from the citizens to demand that they want good public health facilities. When it will come from the citizens, when it comes into a political agenda, that time they will work. Till that time, they are not interested to work.
Hmm. So this was wonderful. Thank you so much, Sati. This was very
Same here.
helpful. Actually, I think since you had a more interactive session where people were putting comments in
Yeah.
during the discussion itself, I think a lot of questions or concerns that people have already came through at that point itself.
Yeah.
If you have any final points to make, we'd like to hear it.
My final points would be that I think now it should be more than nurses. I think the citizen should demand good nursing care.
Hmm.
So I feel the civil societies and others, others in the sense, the citizens should come forward and stand and demand for good nursing care, because the amount of medical errors what are happening on ground is mind-boggling and it is dangerous for their life. So if you really want to bring some change, then I think it should come from the citizen side. Just 30 lakh nurses can't take care of 1.3 billion population. Okay. So I feel that the citizens now should enter and should stop this nonsense, what is happening in the private sector because of no regulations, no governance from the government. And healthcare is becoming, uh, it is a very unhealthy place to get cured, I feel today. And it is very risky. I'm telling you, it is very risky. The amount of problems what are happening on the ground are mind-boggling, and it is painful to see what type of quality healthcare is giving to the citizens of India. So I think the Indian citizens should stand up for themselves today. Instead of we just talking about it, they should take the charge of their own health and demand good quality care from the service providers. That's where I would think I would end my note.
I think this was, I think that's a reflection on the Indian public and private healthcare system as a whole. But thank you so much for talking about it through the
Pleasure.
nurse of lensing. Oh, sorry, lens of nursing. I'm so sorry. This was very helpful. I think lots of people interested in this topic clearly, given the questions and the comments and all that came in. Several people asked about this. We will have this video once it's edited. We will put it on our, we have a playlist on the PHFI.
And I would like to
channel.
add one more thing, Abba.
Yes,
Is
please.
that I think the nursing is not very well researched on the social angle, okay, or on the gender lens. There is lots to be researched by, I think, somewhere the women's movement and the social workers have missed a nursing profession because of many other things, because again, nursing is a closed profession. They don't allow others to enter. But I feel that, it's high time that other professionals do research on nursing and nursing care. That will bring lot of policy level changes because nurses are not trained to do research on issues which are non-clinical. They usually do clinical research. Non-clinical research nurses hardly do. So I feel here the public health people can come in and do a lot of research and empower the nurses and the healthcare.
This is, really a good note to end on. Professor Srilata Rao Seshadri, who is the center's director, actually said that this was a very revealing talk and, an issue that touches all of us. And she says this is a great call to action indeed. So on that note, thank you so much, Dr. Swati, for your time and bringing your expertise to our colloquium series. And many thanks to all of our attendees for participating in this conversation as well. Thank you.
Thank you. Thank you so much.